Apabetalone, also known as ERVX208, represents an important innovation in the treatment of chronic diseases, like atherosclerosis and diabetes-related cardiovascular conditions. Developed by Resverlogics Corporation, a Canadian biotechnology company, this orally administered small molecule drug works through a unique mechanism compared to traditional therapies. Instead of merely lowering cholesterol or blocking inflammatory mediators at the surface level, Apabetalone acts deeper, targeting the epigenetic regulation of gene expression. In simpler terms, it influences the software that instructs cells to switch certain genes on or off, especially those involved in inflammation and lipid metabolism. This property positions Apabetalone as a potential therapy for patients who do not respond optimally to conventional treatments, or who have multiple risk factors that make standard care insufficient. The history of Apabetalone reflects both the excitement and the challenges of bringing a new class of therapies to market. Researchers first discovered the critical role of bromodomain and extra-terminal BET proteins in regulating gene expression. These proteins, particularly BRD4, interact with acetylated histones, small chemical tags attached to DNA packaging proteins, to activate genes that drive inflammation, cholesterol imbalance, and even fibrosis. Early laboratory experiments showed that by selectively blocking the second bromodomain BD2 of BRD4, it was possible to reduce inflammatory signals and improve cholesterol handling without causing the widespread toxicity observed with non-selective BET inhibitors. Encouraged by these findings, Resverlogics initiated a series of preclinical studies that demonstrated Apabetallone's capacity to increase high-density lipoprotein cholesterol and dampen harmful inflammatory pathways. These early successes laid the foundation for the first clinical trials in humans. Apabetalone progressed through Phase 2 and Phase 3 clinical trials with mixed but encouraging results. In the SUSTAIN trial conducted in 2013, researchers observed clear improvements in HDL cholesterol and a reduction in LDL cholesterol among patients with cardiovascular risk factors. However, the subsequent ASSURE trial in 2015, which aimed to measure whether Apabetalone could actually shrink plaque in coronary arteries, did not show statistically significant effects on plaque regression. This setback led scientists to refine their research focus, emphasizing broader cardiovascular outcomes instead of solely plaque volume. The Phase 3 Batten-Mace trial, carried out between 2018 and 2019, targeted diabetic patients at particularly high risk of major cardiovascular events, such as heart attacks and strokes. While the trial showed only modest improvements on the primary endpoint, reducing the overall occurrence of such events, it did demonstrate encouraging trends on certain secondary measures, like lowering inflammation markers and improving lipid profiles. These results have kept Apabetalone in active investigation as a therapy for select high-risk populations. At the core of Apabetallone's pharmacodynamics is its selective inhibition of BD2 bromodomains on BET proteins. This selectivity is critical because broader inhibition can lead to severe, dose-limiting toxicities. By binding specifically to BD2, Apabetalone blocks BRD4's ability to read epigenetic marks that activate pro-inflammatory and pro-atherogenic genes. In practice, this means the drug reduces production of cytokines such as C-reactive protein, CRP, diminishes vascular inflammation, and promotes the generation of ApoAI, the main protein component of HDL cholesterol. The end result is a multi-pronged therapeutic effect: dampened inflammation, improved cholesterol metabolism, and potentially better vascular health over the long term. This epigenetic modulation is part of a new frontier in pharmacology, where drugs aim to reprogram harmful gene expression patterns instead of merely masking their consequences. Pharmacokinetically, Apabetalone is well suited to chronic use. After oral administration, it is rapidly absorbed, with peak plasma concentrations typically achieved within a few hours. Its bioavailability improves when taken with high-fat food, which enhances absorption from the gastrointestinal tract. Once in circulation, more than 90% of Apabetalone binds to plasma proteins, primarily albumin, which aids its distribution into peripheral tissues where it can exert therapeutic effects. The drug is metabolized mainly by CYP3A4 enzymes in the liver, generating both active and inactive metabolites. Because of this metabolic pathway, apabetalone has the potential for interactions with other medications that inhibit or induce CYP3A4, making it important for prescribers to monitor co-administered drugs. The majority of elimination occurs via biliary excretion into the feces, with less than 5% excreted by the kidneys. Its relatively long half-life of about 16 to 18 hours allows for convenient once-daily dosing, an important consideration for patient adherence. Beyond its primary cardiovascular applications, apabetalone broad anti-inflammatory and epigenetic effects have prompted researchers to explore additional therapeutic uses. One area of interest is diabetic kidney disease, a progressive condition characterized by declining glomerular filtration rate, eGFR, and increased protein leakage into the urine. Studies suggest that apabetalone may slow this progression by reducing oxidative stress and suppressing the expression of pro-fibrotic genes. There is also evidence that the drug's vascular benefits could help limit calcification of arteries, which contributes to both heart disease and kidney dysfunction. Perhaps most intriguingly, during the COVID-19 pandemic, scientists examined whether apabetalone could be repurposed to blunt the cytokine storm that leads to severe respiratory and systemic inflammation. Although these investigations remain preliminary, they reflect the growing recognition of apabetalone as a versatile agent with applications beyond cardiology. While apabetalone holds significant promise, it is not without risks. Clinical trials have consistently shown that the drug can cause elevations in liver enzymes such as ALT and AST. These increases are usually mild, asymptomatic, and reversible upon discontinuation or dose adjustment, but they warrant routine liver function monitoring during therapy. Other common side effects include gastrointestinal symptoms like nausea and mild abdominal discomfort, musculoskeletal complaints such as muscle aches and joint pain, and mild infections, including upper respiratory tract infections and urinary tract infections. These adverse events are generally manageable and comparable to those observed with other long-term cardiovascular medications. However, clinicians must also be aware of rarer but more serious risks. These include clinically significant liver toxicity, elevations in creatine kinase that could signal muscle injury, and thrombocytopenia, a reduction in platelet count that raises bleeding risk. The safety profile underscores the importance of patient selection and careful monitoring, particularly in individuals with pre-existing liver disease or other comorbidities. Because of these considerations, apabetalone has specific contraindications. It should not be used in patients with active liver disease or severe hepatic impairment, as the drug's metabolism and clearance depend heavily on liver function. It is also contraindicated in individuals with severe renal impairment or end-stage kidney disease, where accumulation of metabolites could pose additional safety concerns. Due to limited data on reproductive toxicity, apabetalone is not recommended during pregnancy or breastfeeding. Finally, anyone with a known hypersensitivity to the drug should avoid its use. As with any therapy targeting novel biological pathways, the benefit-risk balance must be weighed thoughtfully in each patient. Apabetalone broader significance lies in its pioneering role in epigenetic therapy. For decades, most drugs have worked by inhibiting enzymes or blocking specific receptors, offering symptom relief but not addressing the deeper mechanisms that drive disease. Apabetalone breaks this mold by targeting the transcription machinery itself, effectively dialing down the expression of harmful genes. This approach has the potential to transform not only cardiovascular medicine but also the management of chronic inflammatory and metabolic diseases. While the road to regulatory approval and widespread clinical use may still be long, the evidence so far underscores a paradigm shift in how scientists and clinicians think about controlling disease at the genetic level. In summary, apabetalone is a first-in-class BD2 selective BET inhibitor designed to tackle atherosclerosis and related cardiovascular complications in high-risk populations, especially those with diabetes. It achieves this by regulating the transcription of genes responsible for inflammation, cholesterol metabolism, and vascular dysfunction. Its pharmacokinetic profile allows for convenient daily dosing, while its safety profile, though generally acceptable, necessitates careful monitoring of liver function and other potential adverse events. As research continues, apabetalone promise as an epigenetic modulator extends into areas like diabetic kidney disease and possibly acute inflammatory syndromes such as COVID-19. Ultimately, it embodies the shift toward therapies that target the underlying gene expression patterns that drive chronic disease, rather than simply mitigating their symptoms. The story of apabetalone illustrates both the potential and the challenges of translating advanced molecular science into practical treatments. It also reminds us that in medicine, innovation rarely follows a straight line. From its early days in laboratory research to its complex journey through clinical trials, apabetalone offers hope for a more targeted and comprehensive approach to disease management. As further studies clarify its benefits and limitations, it will remain a focus of interest not only among cardiologists but across multiple fields that increasingly recognize the role of epigenetics in human health.